A wide and splayed foot is actually a big problem for the person who has it. And in this case, we have women's feet, starting of course with checking whether the socks fit in size or not. Yes, they turned out to be a bit small. And let's move straight to determining the length in centimeters. Not so much the shoe size itself, but the actual length, because you need to focus specifically on the centimeters. In this case, it's size 39, which corresponds to 25 centimeters. And in order to figure out how to choose shoes, I recommend taking the insole from a pair of shoes you already own. This is the insole that my model came with, and you just need to place your foot on top of it. We can see that the foot is quite wide and spread out. It's obvious to the naked eye visually. I also put the boot itself next to it, and we can see that these feet are quite wide to fit into these boots. If the client still doesn't believe you and insists everything is fine and the feet fit, try this simple method. Trace your foot on an A4 sheet, cut it out, and compare it with your current insole. And now she definitely won't argue with you, because it's clear that the shoe size doesn't fit in terms of volume, although I would also argue about the length. And the consequences can be like this. In this case, we have blisters on the little toe, which cause a lot of discomfort. Here I'm showing you 2 sets of Carbide Burs, which are perfect for working with this kind of problem. The difference between these sets is only that the new version of the Carbide Burs set has a completely different cutting pattern. I tested the first and second one consecutively. I want to understand and prove to myself that these burrs actually cut better. So I like the new version more because its blade pattern allows for much more efficient cutting. Cork horns, well, that's exactly what you're seeing right now. The problem with a cork horn is that the thickened skin goes inward, meaning it's not so much on the surface as it is going deeper inside. And the client feels as if there's a little pea in there, or maybe something is poking into them. Well, that makes sense because there's dense, hard skin inside, which of course puts pressure on the toe itself. Next, we'll use sterile drill bits from our KMIS factory, which come pre-packaged sterile. This is convenient, especially if you didn't prepare for work or need more drill bits. Always keep these on hand to use right out of the package. I use these drill bits to polish the treated core calluses, and now I'm going back to the Carbide drill bits, which I use to work on the remaining area. Probably, let's say the fracture happened a long time ago. In childhood, she fell somewhere and had pins inserted. I think that people who have had such fractures know what I'm talking about. She ended up with a small scar like this, dry, odd skin that just won't go away. It's been there for many years, and we just decided to clean it up a bit and treat it. But also to have the opportunity to demonstrate how well these Carbide Burs work. And besides, since they were brand new, of course I really wanted to try them out on everything I possibly could. I also complete the processing with the same burr used for filing. The calluses on the pinky toes ended up looking clean, nice, and beautiful. Of course it will all grow back again after some time, but still, we tried and I think the result is good. The main thing is that it handles the calluses perfectly. Now let's move on to treating the toes. There's definitely a lot of interesting things ahead for us here. The client herself complained not only about the core calluses, but also about the fact that her nails don't look very aesthetic overall. Her nails are very twisted, there are a lot of ingrown areas, and of course this really bothers her. I started with talcum powder, specifically Potostop talc, which I often use for pedicures and occasionally for manicures. And I started the treatment with a diamond bit with natural diamond coating, which has a blue stripe. With this bit I treat not only the cuticle but also the skin around it and the nail plate itself. Since the nails are very thick and they are thickened because the feet are cramped, this is a normal reaction of the body. Accordingly, my task is to thin the nail plate a little, and then it will be easier for me to reach those parts of the nails that have gone really deep into the skin. By the way, I realized here that I could even use a Carbide burr, so I took it out properly. I removed the bulk of the nails like this because if the nails are thick, it will be very difficult for you to carefully and safely get the corners out of the skin. The nail plate still needs to be more flexible and elastic. In this case, you can see the consequences of a person wearing very, very tight shoes for many years. This means that there is poor blood flow, it means that very little oxygen is delivered through the blood, and of course it also means that the metabolic processes there are poor. And naturally the growth of the nail plate will be disrupted, its structure will change, and visually it may look different. Next, I will take it in my hands. Additionally, A nail plate softener is a special product that you can and should use when your client has severely curled nails. And now I'll show you what's hiding in the sinuses. Because that's exactly the reason that's the main problem. In other words, that's what bothers our model the most. I'm taking a curette. It's a special little stick for scraping, which allows you to carefully get into all the tubes and of course clean out the subungual contents. Get everything out here, and now we'll see how twisted our nails are. First, a lot has accumulated under the nails. These are remnants of skin, sweat, socks, etc., and we can see how deep and twisted the nail is. That is, it digs right into the skin and a little hole is left in the skin, which you can also see now, and I'm showing it with the curette. The very tip of the nail plate, of course, well, sort of. It's easy to imagine what sensations the owner of these nails feels. Of course, people are amazing creatures and they know how to adapt and get used to, honestly, just about anything. Women regularly wear uncomfortable shoes simply because it looks neater, it looks more aesthetic, and that's what's expected in society. And those to whom I say, you have a wide foot and you need different shoes, they immediately start to feel embarrassed, shy, and say, how am I supposed to wear different shoes? Then I'll have flaps, then people will think something about me, then they'll say that I have, I don't know, a wide splayed foot and so on. But unfortunately, or fortunately by the way, you always have to choose, well, is it about looking pretty or is it still about health? Because sometimes it seems to me that shoe designers, the ones who came up with narrow toes and heels, it's like they don't really like women very much. I have this suspicion because it absolutely doesn't match the natural anatomical state of anyone's feet. And I want to say that if you suddenly feel like your foot is a bit wide and it really doesn't fit, and you did those tests I showed at the beginning, then of course I recommend wearing looser shoes. There are a huge number of brands on the market right now. If you don't know how to search, I recommend typing in a phrase like barefoot shoes in the search, meaning shoes with an anatomical shape, and they have a completely different toe area. At first it looks unusual, but once you try it and realize that you can go through the whole day without tired feet, without any swelling, without heaviness, it's impossible not to choose them. So, of course, the choice becomes obvious. No, I'm not suggesting you completely give up beautiful shoes for events. I also wear pumps and high heels myself, but that's usually at conferences and then backstage, behind the scenes. Of course, I immediately change into something comfortable because my toenails will start to curl just the same, I'll feel tired in my feet, and so on. And of course, it eventually takes its toll. And to be honest, recently I've had a couple of situations where I would just suddenly get cramps for no reason. My legs would seize up, I couldn't even stand, but I still had to keep working. And I personally went out on the Beauty Day stage just recently because there was no way I couldn't go out there. I went out barefoot. That's just how things turned out, and I don't see anything wrong with that. Also, the hall was full of podiatrists who definitely understood my reason. Well, to all women, I want to say that you shouldn't be ashamed of your feet, but you should take a comprehensive approach to the issue and the problem of your nails. Because just like that, due to some genetics, no nails will start growing in or behaving abnormally. Everything happens for a reason. So if you notice changes in your nails, you need to think about why this is happening and address not the consequence, but the root cause. We can treat these nails endlessly, remove the calluses around the nails, like I'm doing now, which form precisely because of the friction from the nail itself pressing into the skin and the side folds. And of course the skin responds to this, and that's how it reacts. So all of this definitely needs to be analyzed and considered depending on the situation. By the way, in this case there are quite a lot of calluses around or under the nails. And the thing is, this callus, as you can see, is attached to the skin in such a way that it's better to trim it rather than pull it out. Sometimes I see people twisting, pulling and removing it like that. Frankly, I disagree because removing it would just leave another wound, and we already have enough. Besides, wounds are always open doors for something to get in, so we don't need that. In this case, I took special nippers that are designed either for working with skin or, for example, with calluses under the nails, and you can also trim the cuticle with them. By the way, if someone uses the technique of cutting out core calluses, you can also use these nippers for working with core calluses. And you can also precisely treat cracks. If the crack is open enough, you don't have to file its edges, but instead you can carefully treat it with nippers like this first. Ultimately, it's about personal taste, habit and skill, whatever someone likes. I always choose my tools depending on the situation and of course on what I have within reach, because not all the tools are always ready to use. Some things might be being cleaned, some are drying, some are in the autoclave, and so on. For these calluses, just be careful not to overdo it and remove them gently. I kept the whole process intentional. It can take longer than 5 or 10 minutes. Sometimes you just sit, carefully picking at it. Notice how thick the callus pads are and how hard they are to pull back. Plus, I have to do this on camera. That's why I worked in very small steps, trying to do it very carefully and in a way that wouldn't hurt the client. And while I'm working, it's already happening with the second toe here as well. Yes, it's surprising, but the nails have curled, the nails have grown in, and there's a piece that's hard to get out. Because it's, well, how can I put it? It's kind of curled inward and almost seems to be merging a bit with that callus near the nail. Everything there has blended into one lump. Look, I'm gently pulling it and I can tell it's really stuck there, so I'm going to keep trimming it further. Meanwhile, I want to highlight the big toe where small lines extend upward from the sinuses. Someone might assume there was a surgical procedure here because I removed this corner, but actually there wasn't. This is just the skin being wrinkled, so it's a natural fold as much as possible under these circumstances. Yes, it looks unusual, but remember the legs are large, flat, wide, and the toes have thick pads. And this can happen, but visually it looks as if a surgeon had worked there before. I asked the client, but she said nothing like that happened. You can see on the screen right now how I'm cleaning out the second periongual callus, right? Carefully so as not to cause any wounds there, but I understand how much has accumulated there over all this time. That is, she never really took care of this treatment before. I also take the straight scissors and carefully treat the other side of the big toe because we've already treated the first side. I carefully cut off the corner in such a way that there are no burrs or so-called spikes left there. This is a risky time for trimming, as some people mention in social media comments. Elena? So you can't cut the corners. In some cases, there are situations when you shouldn't cut the corners, but there are also situations when it's absolutely necessary to do it this way so that you can clean, get underneath, and take a look. As you can see right now, I'm carefully removing everything with a curette, and we can observe something. The place where we had the ingrown nail, it went quite deep. A dent has already formed in the skin, surrounded by compressed skin resembling a callus similar to subungual skin. I also wanted to show you the second toe, but the footage unfortunately came out crooked. But this little piece that you see is exactly the piece of nail that was curled inward, and I just removed another piece. Unfortunately, she has the same issue on both feet. A small hole is visible. The main thing is, after such procedures, you absolutely have to pack the area because since we removed something from there, there might be a wound, so of course we need to pack it. I'm applying an ointment that will help speed up regeneration. I won't mention the name of this ointment. If you know what this ointment is, please don't mention it in the comments. Because unfortunately, people buy it and start thinking that it's enough just to buy it, but it's really just an accompanying thing. In order to get rid of the bump in the skin, of course, it needs to be removed from there. And so to prevent people from being misled and choosing to buy this ointment and then saying, oh, it doesn't really work, I decided simply not to mention it. Right now, I'm duplicating all of this with a tamponade, meaning the tamponade will be soaked with the ointment and it will also fill the space that was previously occupied by the periongual callus. This is done so that the recovery process will be quite comfortable now. This is done to move the lateral fold aside so that the skin doesn't go back to the place where there is no nail plate right now. Because in general, it can fill up all this space quite quickly and successfully for the installation. I use a curette. It's one of my favorite tools in podology. I believe that without a curette, doing a pedicure would be very, not impossible, but quite inconvenient and ineffective. Because this is a tool that we not only use to place the tamponade, but also to remove everything we need to clean, work through, and so on. And in general, we always recommend these curettes to our clients as well. Well, we provide a link, for example, to marketplaces or explain how they can find it so they can place the tamponade themselves at home and maybe check or look at the wall if necessary. But again, every case is quite individual. After treatment, of course, we use a special self-fixing bandage. There are different brands, but if you're looking for this kind of bandage, you need to look specifically for a self-fixing one. You don't need to tie this bandage since it sticks to itself, and you shouldn't stretch it too much. Next, I show that, of course, we take clean socks after this treatment and give them to the client. And now the shoes she came in actually look pretty good overall. But as you can see, even now it's clear that the width of the foot doesn't fit at all. And of course, for this kind of client, a visit to an orthopedist is absolutely recommended because an orthopedist is a doctor who can help with foot issues. Here, of course, the right insoles are really necessary. That's all from me.